it would seem on the surface that we haven't come any farther as we did in today's day and age when it comes to medicine. We have advanced imaging like MRIs, CTs. We could pick up on cancer in its early stages. We could prevent the spread of cancer. We could look at abnormalities in the blood vessels, in the spine, in the nerves, in the brain, in the organs. What are you talking about? That contemporary medicine has fallen short. But the truth is, if you look into it, I believe that's the case. I'm going to read you a list of conditions that I wrote down. You have gluten sensitivity, chronic fatigue, adrenal fatigue, aka HPA axis dysfunction. You have a lot of chronic pain disorders like plantar fasciitis, which is that band of tissue that runs from your heel to the front of your foot. Migraines, sciatica, tendinitis, chronic joint pain. You have other conditions like non-pulsatile tinnitus, which is that hissing and buzzing that you have in your ears. IBS, which is irritable bowel syndrome. And then you even have autoimmune diseases like celiac disease and what else? Celiac disease and Crohn's disease, which is chronic inflammatory bowel problem. These are all conditions where doctors are managing symptoms. We are not curing it. So this is really an issue. Not all the symptoms are being managed. It's really much reducing the quality of life for a lot of people, because a lot of the traditional treatment for these problems are going to be something like going to a chiropractor, going to an acupuncturist. It might mean putting yourself on medication, which means side effects. It might mean lowering your overall physical activity throughout the day. Maybe sleep in a certain position. You have to sit in a certain position. You have to get specialized shoes for your, for your heels, for your feet. Special padding. Maybe it means a neck collar for your chronic neck pain. So we are not curing problems here. There are so many chronic conditions that we're not curing. So we have fallen short. And the reason why we're falling short is because contemporary medicine is not willing to acknowledge the brain-body connection, or the mind-body connection, psychosomatic connection. That there's an intimate connection between the brain, the mind, and the manifestation of physical symptoms. And until contemporary medicine admits and acknowledges this and accepts this for their patients, unfortunately, patients are not going to get better. We're not going to be able to get rid of conditions. We'll be able to manage it like a Band-Aid, but we're not getting rid of it. And that's a really big problem, because people are living with their conditions and it's reducing the overall quality of life. It might be helping, but we're not getting rid of it.